Okay. First off, I just want to say that I have really, really loved this course. I've done residency and now and am doing fellowship and feel like a lot of what we focus on is wonderful at really refining my thinking and my treatment in regards to managing like musculoskeletal pain. But this course has been different in that I've learned totally new things that I've never heard before. So I've really enjoyed it. I would say that for three things learned, like the pain metaphors were wonderful. I have used them many times, and I think I'll continue to go back to that um, like bucket of them that we have now to pull new ones depending on the patient. And along that, a similar vein there as pain metaphors, but also just how to discuss P&E with patients. You know, we learn a lot about how much research is behind it and what kind of good that it does for all of these patients. And it's great, you got to do it. But kind of feeling like, how do I do that? And then, especially after watching some of the Belmont course, really feeling a lot more confident in doing that with patients now. So the pain metaphors, how to actually implement P&E, and then the interventions. I think that was my favorite part of this course. Especially, I love like having concrete things to use. I in the previous couple of modules and discussions, I talked about a couple of patients that I've been using some of the interventions on that have facial neuropathies and definitely have neurological symptoms, but a lot of what they're dealing with pain wise is very chronic and very pain centralization and sensitization versus like a true musculoskeletal or neuromusculoskeletal pain. So I used some of those new interventions on them, particularly the 3-step like laterality, motor imagery, and mirror therapy on them, which was difficult to set up for their face, but they have responded so well to those treatments, and even said that they are now like they have finally started making comments of like, oh, because I'm better, or like because now I'm better, or I'm gonna be done soon because I don't have pain anymore. So like they came in never thinking. They even told me like, if you can get me to 50%, I will be so happy. I go to church with one of them, and she like runs around telling people that I taught her how to trick her brain into not having pain at night, which is just hilarious to show she like explains to people how she does it. But so it's just been very cool seeing it work on some of my patients, and especially some of these patients I really love. And you know, it was an area where I had minimal confidence, and I was honest with them about that. Hey, I'm taking this course and I'd love to try these things on you, and they were very game. And now are like, wow, I love that we timed up with your pain science course because this worked great, and we feel like we took it with you and all this stuff. So I really have appreciated this course and the practicality of implementing those things into my practice. I will say I kind of consider those the two challenges as well. Those two patients are my two challenges that I was able to make a change with in the clinic. So the question I kind of still have mostly has to do with how to measure change. And I know that we talked about that in module 4, like objective measuring of pain. But I do think I still have some like blank spots there, just because it seems like a lot of those measurements are still very subjective. Like with, you know, the brushstroke and the ice and all of that. And the only like feels like the main true objective one is the algometer that none of us can afford in the clinic. So if y'all have any like thoughts to kind of rein in like ways that you do that in the clinic objectively, I would love to hear that, because you know our cases are so test treat retest, and yeah, so just wanting to be able to in my brain make that fit as well as everything else. I feel like that's the one outlier that I I'm having a hard time fitting, and I may not be able to, and that's okay. And then I liked Morgan's question that she said on her video, just about how do we sequence some of the metaphors. Like, I know that it's very individualized and different ones work better on different people, but if there is kind of like a sequence we can use on as a general template, like trying these first and then moving into some of these different ones, if that's even out there, would love to hear it.